Hello everyone. I I am delighted to present to you our work entitled Job Satisfaction of Primary Healthcare Professionals in Public Sector, a cross-sectional study in Morocco. This study was carried out by the team of the Bioscience and Health Research Laboratory, composed of Professor Majda SEBBANI, Dr. Adil Mansouri, Professor Latifa ADARMOUCH, and Professor Mohamed AMINE, and myself, Hicham MOUADDIB. On this occasion, I thank all the members of our research laboratory, and I thank the organizing committee of this conference for giving me this opportunity to communicate the results of our study. Here are the contents of my presentation. Well, as you know, healthcare professionals are indispensable for improving the availability and quality of healthcare services. Concerns exist regarding the impact of their poor performance on the effectiveness or the strengthening effort on the healthcare. The satisfaction, motivation, and willingness of healthcare professionals to fulfill their duties directly influence the quality and efficiency of the service that they provide. However, practicing in a healthcare environment often generates stress, which can ultimately contribute to the turnover of healthcare professionals. Therefore, they strive, healthcare professionals, they strive to achieve an optimal balance between their personal and professional life. This equilibrium is manifested in the workplace through job satisfaction. So the objective of our study was to measure job satisfaction among healthcare professionals in primary care centers in Marrakesh, Morocco. Now for the methods, we conducted a cross-sectional descriptive study in the primary care centers in Marrakesh. The sample included 416 healthcare professionals. We used the job satisfaction scale, which included 15 quantitative items, and the 60th item evaluates the overall job satisfaction. This scale is a 7-point Likert scale with two subscales. The first one concerns intrinsic job satisfaction, which includes paired items, and the second one intrinsic job satisfaction, which includes odd items. Data collection was made by an electronic questionnaire from January the 80th to March 31st, 2021. Data analysis, we used Jamovi version 1.6. We performed descriptive analysis and bivariate analysis, and the statistical significance was set at p-value under 0.05. Now for sociodemographic and professional characteristics of participants. The study population, as I said, included 416 healthcare professionals, 65.9% of whom were women. The professionals profiles of the healthcare professionals included nurses with 54%, GPs with almost 40%, and specialists with 6.1%. The greatest proportion for GPs was under less than 44 years old, while the greatest proportions of nurses and specialists were under less or equal to 44 years old. Among the nurses, 85.6% was graduates. Among GPs and specialists, 53.6% and 57.1% respectively practiced in rural settings, whereas 50.3% of nurses practiced in urban settings. Apart from GPs, 54.3% of whom had a global length of services of greater than 18 years. The greatest proportions of the healthcare professionals with other professional profiles had a global length of service of less or equal than 18 years. Similarly, for the length of service in primary care, unlike other professional profiles, the greatest proportion of GPs had a length of service in primary care of greater than 14 years. Now for the healthcare professional job satisfaction. Overall, except for the relationship with immediate supervisors, relationship with colleagues, administrative support, degree of responsibility, and working hours, for which professionals had a moderate level of satisfaction, they had a low level of satisfaction for other aspects. Among these aspects, some had mean scores under 2.0, which were recorded for GPs and nurses. These aspects were work safety, salary, chance of promotion, possibility of using their abilities, and workload. Specialists also had mean scores under 2.0, which were work safety, chances of promotion, and salary. A statistical significant difference was observed among the healthcare professionals with different professionals profile regarding center management, with P equal to 0.049. Now for the overall job satisfaction mean scores, which is the item number 16 or 60th items. Regarding overall job satisfaction, healthcare professionals were weakly satisfied. In addition, male professional, those practicing in rural areas, those belonging to the age category greater than 44 years, and postgraduate holders were the least satisfied. Regarding work experience, healthcare professionals with length of global service of greater than 18 years and those with length of service in primary care of greater than 14 years were the least satisfied. None of the aforementioned characteristics were statistically significant. Now, regarding the mean scores of the subscales for the table number 4, regarding the mean scores of subscales, intrinsic job satisfaction was low, with the lowest scores being recorded among male, those practicing in rural centers, and postgraduate degree holders. Furthermore, extrinsic job satisfaction was at a medium level, with the highest score being recorded among those practicing in rural centers, and postgraduates. None of the previously mentioned characteristic was statistically significant. Now for the table 5. This table highlights the subscales scores in relation to age, length of global service, and length of service in primary care. The intrinsic job satisfaction was low for these parameters. The lowest scores was recorded among healthcare professionals aged greater than 44 years, those with length of global service of greater than 18 years, and length of service in primary care of greater than 14 years. Moreover, extrinsic job satisfaction was at a medium level, with higher scores recorded among healthcare professionals aged less or equal than 44 years, those with length of global service of less or equal to 18 years, and length of service in primary care of less or equal to 14 years. No scores were statistically significant except for intrinsic job satisfaction with respect to age, with b equal to 0.035. Now we move to discussion. With some aspect scoring under 2.0, nurses were the least satisfied with their job safety. In fact, working in clean, organized, and safe environment is an essential source of job satisfaction among nurses. Moreover, GPs were the least satisfied with other aspects, such as salary, possibility of using capabilities, promotion opportunities, and workload. In fact, studies conducted solely among GPs show that they had average satisfaction with their salaries. However, they were highly satisfied with the possibility of using capabilities. Similarly, in studies that examined several occupational categories, the average score of GPs in terms of promotion opportunities was among the lowest. Conversely, nurses had the lowest scores concerning workload. With regard to overall job satisfaction, GPs and nurses were the least satisfied in our study. Men reported low levels of satisfaction. Thus, sex remains a factor to be considered in the overall satisfaction of healthcare professionals. For the intrinsic job satisfaction, it was at low level, while extrinsic job satisfaction was moderate. Even intrinsic or extrinsic job satisfaction, age, work environment, hours worked per week, and length of professional service are predictive factors for job satisfaction. However, no clear trends exist regarding the reported satisfaction with intrinsic factors compared to extrinsic factors. As a conclusion, we can say that the study findings highlight the presence of dissatisfaction among healthcare professionals regarding various aspects of their jobs. Although extrinsic factors indicate a moderate level of satisfaction, intrinsic factors were lacking. GPs and nurses, particularly the male participants, were the least satisfied. The findings also suggest that specific work environments, such as practicing in rural centers and being postgraduates, may contribute to greater dissatisfaction. Improving job satisfaction among healthcare professionals should be prioritized for enhanced overall job satisfaction and quality of care, and further research and targeted interventions are warranted to address the identified areas of dissatisfaction and improve the overall job satisfaction of healthcare professionals. Here are the references, and thank you for your attention. And again, I thank the organizing committee for giving me this opportunity. Thank you.